So now, finally, we have the honor to introduce one of the co-hosts here, Professor Atef Elbahry. He's known to you for a long time. He's also known to me for the longest time of anyone in this room here, apart from Christoph, because I know Atef since, I think, 2010, so for many years now, when he came and took part in a beautiful joint experience in Freiburg, a preceptorship forum on atrial fibrillation and anticoagulative therapy. This is where we first met. This is where we laid the foundation for a long-time friendship. So please, I'm very happy to hear you talking on triglycerides now.
Thank you, Andrea, for the introduction.
Hi, everybody. This is Dennis Wolf from the University Heart Center in Freiburg, Germany. Welcome to this virtual
the slides
presentation
of Atef, please. Huh? I'm sorry. The slides of Professor
So the triglycerides, a novel target or just a bystander. This is my disclosure. Since the 1979, they know that there is the postprandial lipemia is an independent risk factor for cardiovascular disease, and many studies show that triglyceride is very important. And the fasting triglycerides are strongly related to cardiovascular disease risk. This is from the ARIC study and from Graham Heart study that show that the events increased across the range of triglyceride levels about 50 milligram per deciliter to 200 milligram per deciliter, after which the relationship flattened out. And approximately 1 in every 4 patients with atherosclerotic cardiovascular disease in general population may have hypertriglyceridemia and controlled LDL cholesterol. From the Copenhagen City Heart Study and Copenhagen General Population Study, the hypertriglyceridemia is linked to myocardial infarction, ischemia, and all-cause mortality and ischemic stroke. The elevated triglycerides are independent risk of increased cardiovascular risk from database from men and women aged more than 45 years with documented diabetes and or atherosclerotic cardiovascular disease presented having statin therapy. And atherosclerosis occurring with hypertriglyceridemia is the same as LDL cholesterol, as we see by invasion of the endothelium and causing the plaque, same like the LDL cholesterol. So hypertriglyceridemia is considered a residual triglyceride risk if the triglyceride is more than 150 milligram per deciliter. So therefore, the triglyceride is not a bystander, but a target for urgent therapy. And therefore, if we see the ApoC3 loss of function mutations, remnant cholesterol and low density lipoprotein, they found that there is a reduction of 41% of the ischemic vascular disease and 36% reduction of ischemic heart disease if the ApoC3 has a loss of function. And this means no hypertriglyceridemia. And we can see here also the association of the angiopoietin L3 loss of function, that mutations, that those patients have low risk of coronary heart disease due to no hypertriglyceridemia. Therefore, this angiopoietin deficiency, as we see here, they have no coronary heart disease with loss of function, and there is a 34% decreased risk of coronary artery disease in heterozygous angiopoietin deficiency, and 35% decreased risk of myocardial infarction in low tertile and angiopoietin L3 concentration. Therefore, the targets of RNA-based drugs for atherosclerotic diseases, as we see, targeting it by small interfering or ASO, we have now some drugs that in the pipelines, and the approach trial showed that volanesorsen and the triglyceride levels in familial chylomicronemia syndrome, here the triglyceride was decreased by 77%, but the adverse events was very high at the site of the injection and the thrombocytopenia. So we should be cautious for these drugs. Another successful drug treating hypertriglyceridemia by stopping the apolipoprotein C3 is the olzarsen, that show that it's the primary endpoint was decreasing the familial and the multifactorial chylomicronemia, decreasing pancreatitis and severe hypertriglyceridemia, and reducing the cardiovascular risk. Also, the evanacumab is a fully human monoclonal antibody that is an inhibitor of the angiopoietin L3, and it also decreases the ApoB, non-HDL, total cholesterol, triglyceride, and lipoprotein A. As we see here, it's very important to know that these drugs are very important. Evanacumab in HoFH, we can see the percentage of lowering LDL cholesterol levels and the absolute change in LDL levels. And the safety was very high. The evanacumab may provide an effective treatment option for patients with homozygous familial hypercholesterolemia who are unable to reach target LDL despite multiple conventional lipid-lowering therapies with or without apheresis. Lastly, a novel and cost-effective therapeutic peptide vaccine improves dyslipidemia and associated diseases. Here we can see we can stop the angiopoietin L3 vaccine in 30 weeks durability, no toxicity, reduce the circulating triglyceride, and now it is in the pipelines. It decreases the hypertriglycemic patient, improve the fatty liver, and reduce the lower circulating LDL cholesterol and the small dense LDL level, and improved atherosclerosis by reducing antibody-mediated immunity and neutralizing the antibodies against the angiopoietin L3. So familial hypercholesterolemia is here we can stop it, and we can use it for the treatment of hypertriglyceridemia. Therefore, my takeaway message, the triglyceride is an independent atherosclerotic cardiovascular risk, and the triglyceride is not a bystander but a novel target. And thank you very much for your attention.
Thank you, Atef. Thank you, Andreas. Thank you, Chris, and all the faculty. And I think we have to move rapidly. Thank you, Atef, because of the we have a delay in time. So we'll move to the next session, which is Menarini Industry Supportive CME activity. And actually, as I told some of our colleagues yesterday, that this drug, actually, ranolazine, actually I have no experience in using these drugs. When I meet some of the guy of Menarini, and they explain me the mechanism of action of the drugs, and that this drug is in the guidelines. And as you know, ischemia is a complex disease, and the medical treatment is very important part. So I think that we should know something about these drugs, which are used, I think, is not on a wide range in our daily clinical practice. So Dr. Ahmed Bendari will give us some idea about these drugs in 15 minutes or something like that.